Hi everyone, and welcome back to colorectal cancer in young adults, which is all about raising awareness regarding the increasing incidence and mortality rates of colorectal cancer in individuals under the age of 50 years old. In this video, I would like to talk about some questions that would be helpful for patients with early onset colorectal cancer to ask their oncologist. And the first one would be, are there any genetic factors or hereditary conditions that may have contributed to my cancer? Identifying genetic factors and hereditary colorectal cancer syndromes is important for managing the tumor of these patients, as well as may have implications for their family members, because genetic testing and counseling can provide valuable information for personalized medicine and treatment, as well as for securing recommendations. The second question that would be helpful for early onset colorectal cancer patient to ask the oncologist would be about the location of the tumor, whether the tumor is in the right side of the colon, left side of the colon, or rectum. By asking these questions, early onset colorectal cancer patients can gain a deeper understanding about their diagnosis, treatment options, potential outcome, as well as follow-up care. Because, for example, in terms of treatments, we know that rectal cancer usually requires a combination of radiation therapy and chemotherapy, while colon cancer may primarily involve surgical interventions. And in terms of prognosis and survival rate, we also know that right-sided colorectal cancer usually has poor prognosis. So by asking this question about the location of your tumor, you can engage actively in your treatment journey, as well as seek appropriate support. The third question that would be helpful to ask your oncologist is about the MSI status of your tumor, whether your tumor has MSI high or low, because patients with MSI high tumors usually have high immune infiltrations and they are responsive for immunotherapy. So you might be eligible for taking immunotherapy if your tumor has MSI high. In addition, knowing MSI status might be helpful to identify whether there are some genetic risk factors involved in developing your cancer, because Lynch syndrome patients, which is the most commonly hereditary colorectal cancer syndrome, have MSI tumors. The fourth important question to ask your oncologist is about somatic mutation status in KRAS and BRAF genes, because mutations in these genes can affect response to certain therapies, for example, anti-EGFR therapy. So if you have wild-type KRAS tumor, you might be eligible for taking anti-EGFR therapy. In addition, knowing the mutation status in these two genes might be helpful to understand the potential outcomes of the treatment and the prognosis, because BRAF mutations are usually associated with right-sided colorectal cancer. They are more likely to be diagnosed at advanced stage of the disease, and they are more likely to be female and have poor prognosis. The other important questions for early onset colorectal cancer patients to ask the oncologist is about the immune score of the tumor, whether the tumor has high immune score or low immune score. And this is important because, according to studies, patients with high immune score tumors usually have better prognosis and higher 5-year survival rates. So by asking these questions, again, you will have a better understanding about the treatment prognosis. And the last and one of the critical questions that all young adults with colorectal cancer should ask the oncologist is about the long-term and short-term side effects and risk associated with treatment. Young adults with colorectal cancer have unique concerns related to their age. For example, fertility preservations, career consideration, psychosocial aspects, as well as long-term survivorship. Discussing how the treatment plan will be customized to address these specific needs will help patients to navigate the challenges they may face and ensure holistic care that address the specific emotional, physical, and social well-being. So again, questions related to the role of genetics, the location of the tumor, MSI status, KRAS and BRAF mutation status, immune score of the tumor, as well as the long-term and short-term side effect and risk associated with the treatments are the important questions that all young adults with colorectal cancer should ask their oncologists.